Diagnosis of liver cirrhosis. Early stages of cirrhosis can be asymptomatic, and to diagnose it, the healthcare provider will ask a series of questions such as diet, alcohol use, and medical and family history. A physical examination should also be performed. These include auscultation and palpation of the abdomen area. In the cirrhosis disease, the liver can feel firm or enlarged when palpated. Then, to a more accurate diagnosis, the healthcare provider will request blood tests, imaging tests, and further examinations such as biopsy. There are many different types of blood tests used as an indicative of cirrhosis disease. However, none of them are specifically to diagnose cirrhosis. This will be done with a combination of other examinations. The most important test is the liver function test. It shows the presence of enzymes and proteins produced by the liver in the blood system. It measures necroinflammations, clotting factors, bile blockages, and so on. Imaging tests are also very important. Ultrasound uses a small handheld probe to take two-dimension pictures of the abdomen area, including the vessels. CT scans and MRI scans are also very useful. It's a computerized machine that takes 2- and 3-dimension pictures of the body from different angles. The patient has to lie very still, otherwise the picture can become blurry and distort. And it's also a very high resolution picture too, which makes it easier. All these types of imaging tests can show the shape and condition of the liver. It helps to identify ascites and portal hypertension. Nodules can also be detected due to chronic hepatitis and leads to cirrhosis. However, this is a little bit difficult to see in these types of scan unless it's surrounded by fibrosis. As I saw a picture here showing ascites in the patient's abdomen area, ascites is fluid retention. Transient elastography. It's a machine also known as FibroScan machine. It uses sound waves to measure the level of fibrosis in the liver, estimate liver damage, and monitor the disease progression and regression. It can be used as a replacement of liver biopsy and is a non-invasive procedure with accurate results. If the healthcare provider is still unable to diagnose cirrhosis, he can request a biopsy of the liver. The biopsy of the liver is the gold standard for diagnosing liver disease. It uses a small needle to collect a sample of the tissue sample of the liver, and seeing under the microscope, that's how it looks like. So that's the liver cirrhosis. It's a very invasive procedure, and it has low patient acceptance rate due to its complications such as bleeding, pain, allergic reaction, and costs. Sampling error can also occur, since 10 to 15 milligrams of sample tissue represents only a tiny fraction of an organ that weighs 1.5 kilos. However, liver biopsy can certainly improve the diagnosis of cirrhosis.